Hi everyone, I am Montelukast and this is my autobiography. My generic name is Montelukast. I have also another name which is singular. You can call me by that name too. I have a chemical name too, which is quite complicated. For my drug classification, I am pharmacologically classified as antiasthmatics. An antiasthmatic medication with two distinct actions in the airways of patients with reversible obstruction, smooth muscle relaxation and suppression of the response of airways to stimuli. For my therapeutic classification, I am classified as leukotriene receptor antagonist. I am a new class of drug for asthma treatment, available in tablet form. My unique mechanism of action results in a combination of both bronchodilator and anti-inflammatory effects. I belong to the pregnancy category B. This means there is no evidence of risk with use in pregnancy. Uncontrolled allergies may lead to worsening of asthma, therefore it is important to maintain your allergy control as well. And now for my mechanism of action. I block the binding of leukotriene D4 to its receptor. Alters pathophysiology associated with inflammatory process that contributes to signs and symptoms of asthma. Now let us come to the body's response once I enter the body. For absorption, my bioavailability is 64% and for my distribution, I am protein bound greater than 99%. For metabolism, I am metabolized by CYP3A4 and CYP2C9. For excretion, I am excreted in feces 86% and in urine 0.2%. I am indicated to patients that have asthma. Seasonal allergic rhinitis. Perennial allergic rhinitis. And the prevention of exercise-induced bronchoconstriction. I am contraindicated to patients that are hypersensitive to me or my components. Avoid use with aspirin and other NSAIDs in patients with known aspirin sensitivity because drug hasn't been shown to affect bronchoconstrictor response to aspirin and other NSAIDs in aspirin-sensitive asthmatic patients. And these are my side and adverse effects. In CNS, I may cause headache, asthenia, dizziness, fatigue, fever, somnolence, and weakness. For eyes, ears, nose and throat, conjunctivitis, otitis media, nasal congestion, nosebleed, laryngitis, sinusitis, pharyngitis, rhinitis, tonsillitis, and dental pain. For the gastrointestinal, abdominal pain, dyspepsia, infectious gastroenteritis, nausea and diarrhea. For hematologic, systemic eosinophilia. For the genitourinary, viria. For the respiratory, upper respiratory infection, cough, wheezing, and pneumonia. For the skin, rash, dermatitis, urticaria and eczema. Other side effects include flu-like symptoms, trauma, varicella, and viral infection. Please take note of these nursing responsibilities. Assess patient's underlying condition, monitor patient for effectiveness. Drug may cause behavior and mood changes. Monitor patient and consider discontinuing drug if neuropsychiatric symptoms develop. Inform caregiver that the oral granules may be given directly into the child's mouth. Dissolve in 1 teaspoon of cold or room temperature baby formula or human milk. Tell caregiver not to open packet until ready to use, and after opening, to give the full dose within 15 minutes. Advise patient to take drug daily, even if asymptomatic, and to contact prescriber if asthma isn't well controlled. Warn patient not to reduce or stop taking other prescribed antiasthmatics without prescriber's approval. Advise patient to seek medical attention if short-acting inhaled bronchodilators are needed more often than usual during drug therapy. Warn patient that drug isn't beneficial in acute asthma attacks or in acute exercise-induced bronchospasm. Advise patient to keep appropriate rescue drugs available. Advise patient with known aspirin sensitivity to continue to avoid using aspirin and NSAIDs during therapy. That's all for my autobiography. Love, Montelukast.